Cerebral injury is basically any trauma to the head, to the skull, and to the facial structures that is heavy enough to cause a lot of internal damage, and it can also relate to concussions. Concussions are basically trauma which is basically of a moderate type and can also affect the brain structures as well. So these are basically the highlights for this fourth section that we are going to discuss over here. Now, this section basically deals with the mechanical events in the primary brain injury. So, the mechanism of the brain damage is discussed in detail in this section. What are cerebral contusions and what are lacerations? So, cerebral contusions is basically any heavy blow to the head, which can cause the subdural hemorrhages, the extradural hemorrhages, even the subarachnoid hemorrhages are also included in the contusions because these contusions can affect the brain structures in relevance, and that has its own forensic implications because a trauma can be a result to it. Although there are a lot of causes for these external hemorrhages and these internal hemorrhages, but still these contusions are the mainstay, and the trauma, for example the lacerations, they have their own importance forensically if we are talking about that. So, the mechanical events that contribute to the primary brain injury are, first of all, the mechanical loading. So, the mechanical loading can be of two types. It can be static and it can be kinetic or dynamic on the other hand as well. So, if it is static, then it can have a contact force. The contact can be a local skull bending, and it can as well be a skull volume change, or the contact can have only the shock waves. So these are the three types of contact these static forces can implement. And again, all of these contacts can basically result in a tissue strain or in a deformation state. And this tissue strain or the deformation is the result of the injury. And the injury is basically caused by the compression. Compression may be to the scalp or to the bone. So this flowchart is basically a summary of how these mechanical events can take place. And it can be a static force and it can be a dynamic force as well. So these tension vessels can be a part of it, and of this damage, and which can also result in the injury. And then we can have a sheared brain, and that will also result in the injury to the brain. So that is basically how the static forces are going to act. This is the layout for the static forces. On the other hand, if you're talking about the dynamic forces, what happens here is we can have an impact dynamically, as in a moving car, for example, a moving vehicle, or we can have an impulsive dynamic impact. So what will happen that the head will be in motion. Basically, the moving object will provide its kinetic energy to the static object, and the head will come in motion. Now, what will happen is it can be a translational phenomena, it can be a rotational injury, and it can be an angular phenomena. So all of these type of damages basically come into play over here. Again, all these forces can result in the tissue strain. The tissue strain will again form all these type of injuries or the trauma that can include the scalp or the bone and the vessels and the brain. So that will basically be the type of injuries that can occur in the brain. So this is basically a very complete, a very comprehensive flow chart that is emphasizing on the mechanical events that are taking place in these brain injuries, whether they can be of any sort, traumatic, and trauma can be of different kinds, of course. So the mechanism of brain damage. Now, what happens here is this is basically the normal forensic anatomy. As we were discussing, there are three protective layers that are quite specific to the brain. That is the arachnoid, the dura, and the pyometer. Again and again, we're emphasizing on that. So that can be, that you can memorize these things very importantly, because they're very important and they're the baseline. Whenever we are discussing any pathology, you should be knowing the anatomy and the physiology behind it. So that is why we are focusing on this anatomy. And obviously the skin layers, the skin, the connective tissue, the aponeurosis, the loose areolar tissue, and the pericranium is something that is basically covering most of the parts of the body. So these are again protective layers, protective mechanisms. And If there is a breach in all these protective mechanisms, in all of these protective layers, it will cause damage to the brain. Now, the damage can be by a direct intrusion. So we were already emphasizing that there is an intrusion phenomena whenever there is trauma to the brain. Basically, it is basically a contact phenomena that will compress the brain, and this compression is known as intrusion over here. This intrusion can be by a foreign object or by the fragments of the skull in a compound fracture. So if the blow was heavy enough to cause a fracture, it will cause a depressed fracture, and again there will be an intrusion phenomena. So all of these things can relate to the brain damage. Then we have the deformation of the brain. That is also very important in closed head injuries, and the mechanism of injury, which can be complicated and can be variable. So closed head injuries are basically discussed later on. It's basically involving the coup and the contra coup injuries, and I'll be discussing that in detail. Now, the theories of the impact of the brain damage. It's basically the rotational shear force theory. That is very important. And then we have there are a lot of theories there. We have the pressure gradient theory, the pressure from the external surfaces that can be a part of the brain damage. Then we have the vibration theory, the to and fro and the back and forth movements can cause a brain damage. Then we have the transmitted wave force theory, that is the shocking wave theory. Shock waves are basically produced in the brain, and that can result in the brain damage as well. Then we have the brain displacement theory, that the brain was displaced so sheerly and so effectively that it causes the brain structures or the neurons or the axonal injury. And lastly, we have the skull deformation theory, which is also known as the intrusion theory. And the intrusion is basically due to the fractures or due to the impact with the foreign objects. So basically, all these theories are there, how the brain is damaged. But again, the mechanics include the trauma or the hit by any foreign object. That was the basic mechanical theory behind it. So what basically happens is, the acute physical disruption of the cerebral tissues. What are the causes to this disruption, that damage that we were talking about? That is basically the disruption of the cerebral tissue. So the compression of the constituent units by their being forced together, it is the mainstay. Then we have the tension of the units which pulls them apart. It is again very important. And then we have the sliding or the shear strains which move adjacent strata of the tissue laterally. So basically all these causes are a part and parcel of the theories that we were discussing in the previous slide. So it's basically correlating with these causes as well. Then we have the cerebral contusions. Contusions is again a blow or the hit to the head or the scalp or to the skull. It can be intraparenchymal. Then we have the coup and the contra coup injuries. The blow to the head is important over here. Then we have the sudden decelerations and the brain impacts inner tables. They're also a part of these cerebral contusions. We have to look for scalp contusions and the halo of the edema over here. Then we have the cerebral lacerations. They are related to the contusions and occur when the pia or the arachnoid membranes are cut or torn. So basically there is a laceration. It can be incised or it can be a jagged laceration. And when it is severe, the cerebral surface is fissured. The fragments of the cortex are detached. There are deep lacerations run into the depths of the hemisphere. Then there are deep hemorrhages, and the pia mater and the arachnoid mater are torn over here. As a result, the corpus callosum is commonly torn in these cerebral laceration cases. So in this section, basically, we dealt with how is the brain damaged, what are the layers of the brain that are providing the protection, what is the mechanics involved, and what are the theories and the causes involved in these brain damage or these scalp accidents. So they are forensically, they have their own implications. That was the end to this section. Thank you for watching sqadia.com.